Well, when it comes to COVID-19, we all have a lot of questions, and every day at this time, we are getting you the answers you need. Joining us again, he's infectious diseases specialist, Dr. Isaac Bogoch. Thanks for being here this morning.
Good morning.
Here's a question that we haven't had come up for a while, which is, are digestive issues a warning sign of COVID-19?
There have been a few examples where people have only presented with diarrhea as the presenting symptom. It hasn't been that common. It has been reported, though. And, if people feel generally unwell and they have diarrhea, it might be worth thinking about this. And certainly it's easy to call the local public health line, and you can discuss this with an expert to really determine if this is the time to pursue this and to pursue diagnostic testing.
Doctor, do we know if that is lumped again together with the signs of shortness of breath and fever, or would it just be diarrhea alone that you would call about?
So interestingly, and I don't want to alarm anyone because diarrhea is a common symptom with lots of infections, but there have been a few, not many, but a very few reported cases where the presenting symptom was just diarrhea. It's interesting because in many of those cases subsequent to that, they did develop a fever. Some did and did not develop a cough. But again, if this is a question to ask, there are health professionals on the phone ready to talk you through this. And if it's worthwhile getting a diagnostic test, they can point you in the direction of the closest test center.
We are looking at approaching 10,000 cases here in Canada. I know a question of gloves has come up a lot. And we're talking here specifically about the non-disposable kind, like your ski gloves and your mittens. If I wear them outside, should I wash them when I get home?
So I think one of the key points here is that, remember, gloves are not going to be the be-all, end-all to protect people, and gloves will do nothing if you're still touching surfaces around you and ultimately touching your face. So but if people can choose to wear gloves, that's completely acceptable. If that's what they're doing, that's completely acceptable. We just have to be mindful that it may not offer the same level of protection that they may think. If they're not using disposable gloves, then these should be washed because they're in touch with the surfaces around them. They may have the virus on them. The virus can certainly stick to them. So if people are choosing to wear gloves, you should wash them. Absolutely should wash them with soap and water.
All right, finally, this question coming from Twitter, and I found it fascinating. Why did SARS not become a global pandemic in the same way that COVID-19 has?
Oh, great question. I mean, it was very easy to identify people with SARS. People with SARS got very, very sick. It wasn't hard to identify them. And of course, we know the range of symptoms with COVID-19 is broad. Some people get very, very sick and sadly succumb to this illness. Some people are sick enough to make it to the hospital and won't even seek medical care. So there's many reasons. That's one of the reasons why I think COVID-19 really spread broadly. Also, people may be shedding more virus with COVID-19 infections. That's a bit controversial, but the virus is shed from the upper respiratory tract in COVID-19. Again, the first point is probably the more accurate point, and there's a lot of different theories. But mainly with SARS, it was pretty easy to identify and isolate people in their close contacts.
Dr. Bogoch, always good to talk to you this time of day. Thanks so much.
Have a great day.
And a reminder to you, if you have questions for Dr. Bogoch about COVID-19, please send them our way. You can do that through Facebook, Twitter, or Instagram. Here's the addresses here for you. Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.